Hi to everyone. So now we'll just dive into this topic. Okay. The first thing is we should know what are the risk factors for the cardiac condition. The risk factors for the cardiac condition, the first thing is metabolic syndrome. So what do you mean by the metabolic syndrome? Metabolic syndrome means what happens is it is a consists of a few risk factors before a condition, full-blown condition occurs. So metabolic condition is because of a condition where you have a lot of risk factors aggregating and you're prone for the diseases. So what are the risk factors we can prone you for the heart diseases? The first is you have an expanding waist size. If you have a lot of belly fat is one of the risk factor for your heart disease. And the belly size should not be more than 40 inches in case of a males and 35 inches in case of a female. So waist hip ratio is very important if you want to maintain a proper heart health. Second is the fasting blood glucose should not be more than 100. Okay, that is the second criteria. Third criteria is triglycerides, which is a bad cholesterol, should not be more than 150. And the good cholesterol, which is HDL, should not be less than 50 for females and less than 40 for males. That is very, very crucial. And last factor is the inflammation. The inflammatory marker should be less than 1, or it is called cardiac CRP. So C-reactive protein should be less than 1. So if you have 3 of the above factors which I mentioned just now, then you are prone for cardiac condition. Second thing is, which are the other conditions you are prone for? Second thing is, if you have a diabetes, if you have a long-standing diabetes, then there are chances then you have aggregation of clots within the vessels, and it decreases the flow of the blood vessels. So you have to see the marker, that is glycosylated hemoglobin, which is very important in case of a diabetes, because that will help you in monitoring your sugar levels. It should be normally less than 5.7, and anything more than 7 means your diabetes is uncontrolled. Third factor is inflammation. So most of the cardiac diseases, now we have a faulty diet, and because of the faulty diet, there's a lot of inflammation. So inflammatory markers are very high. You have to check your cardiac CRP, which is, if it is more than 1, it is more than 1 or 1 to 3, he said you are risk for the heart disease. Then your hypertension, your BP is very crucial thing in monitoring your cardiovascular disease. There is systolic BP and the diastolic BP. Suppose your BP is 130 by 80. The 130 is a systolic and 80 is a diastolic. So what do you mean by the systolic? If the systolic BP, the higher one, is very, very high, then you're prone, it means your vessels are stiff. So flow to the vessels are taking a lot of time. If your diastolic is more, means that the lower value is more, then it means your heart is stiff. So this way you can make out where is the problem occurring. Then the most common condition nowadays is obesity. Obesity is one of the killer nowadays because it increases the risk factor for heart disease, it increases the risk factor for hypertension, diabetes, all conditions, risk factors are increased because of this obesity. And especially the fat in the tummy is very, very toxic fat. You know that the toxic fat, why it is called toxic fat? Because it causes release of inflammatory markers. And if the inflammatory markers are released, and then it causes your CRP to be very high, and it causes a lot of cardiac conditions. So it blocks basically the causes plaques and blockage of the vessels. So obesity is one of the killer factors. Then other factors like chronic smoker. If you're a smoker, then you're also prone for plaque formation. You're also prone for a lot of conditions because you can go into vasospasm immediately. And then the cholesterol, high cholesterol. There are 3 types of cholesterol you should know. That is triglycerides, there's LDL, and this is HDL. HDL, it is a good cholesterol, means it carries the harmful cholesterol from the body, that is HDL. And LDL is a bad cholesterol, and triglyceride is also bad cholesterol. So this these 2 cholesterol should be less, and HDL should be very high because it is a garbage collector. So these are the risk factors, and one more additional risk factor which can be added now is unhealthy lifestyle. That means you are not doing any sort of exercise, you're just sitting down at one place and not doing any exercise. That can be one of the risk factors, because according to cardiologists, the less it should ideally be the activity should be at least minimum 30 minutes per day to have a protective effect on the heart. So these are what are the risk factors you should know in case of a cardiac disease. Now I'll tell you one thing what is very important. Our body has a own internal pharmacy. If you see the vessels, I'll just show you one pictorial diagram now. So this is diagram, this is like a blood vessels, and this is the endothelium, which is and this red things are substances which are released from the blood vessels. So what happens is, when you have a healthy food and healthy lifestyles, these blood vessels are free flowing, it can flow easily, and the endothelium releases one factor called nitric oxide. So nitric oxide is a vasodilator which helps in controlling your BP, and it also improves the circulation of the blood vessels. So means if you have a healthy food, if you have a healthy lifestyles, then these factors will be released from the endothelium, which helps in preventing of clotting of the blood vessels. Means your vessels are your own internal pharmacy. So you have to maintain your vessels in a proper state. Now what will happen in case of if you have a poor diet and unhealthy lifestyle? So this is what happens. You have a clotting of blood cells. This red thing which I mentioned is when you have some poor diet, the sticky substances get accumulated here. So what will happen is, the chemicals from the endothelium will not be released, the nitric oxide is not released, so the clotting of the blood factors will happen here. So this is the internal pharmacy which is closed. So this is how your own body can act as an internal pharmacy. You have to protect your blood vessels, because this will help you in releasing nitric oxide, which is very important in maintaining BP. I hope you are all there with me. Did you find this very valuable? Just mention in the comment. It's a very valuable tip I mentioned now. Okay. So let's move ahead. Now I'll be telling you which are the valuable tips which are required for you to protect you from the heart. Now first thing is, you need to have a healthy fat. It means you have to take a right healthy fatty food, not a low fat food. So what do you mean by the healthy fat? Healthy fat is like fatty food which will help you in protecting your blood vessels. Now healthy fat is basically, you have factors like omega-3 fatty acids and omega-6 fatty acids. Now most of the foods and vegetables are rich in omega-3 fatty acids, and inflammatory foods are mostly omega-6 fatty acids. So what happens is, you have to have foods, real foods, fruits and vegetables which contains omega-3 fatty acids, and not inflammatory foods like fast foods, meat and all, because that is omega-6 fatty acid which is dangerous for your body. So omega-3 fatty acids you can find in the fatty fish. You have, if you can consume fish, if you in case of a non-vegetarian, the omega-3 fatty acids are rich in fatty fishes. So which are the fishes you can consume which contains this omega-3 fatty acids? Mackerel, salmon, sardine, oyster. These are all the fishes. At least if you can consume twice a week, it has been said that the heart rate decreases by at least 30 to 40% if you have this fatty fish. Now the omega-3 fatty acid, how it helps your blood vessels is, it increases your nitric oxide. Just now I told you our blood vessels releases nitric oxide, so it helps us in keeping the blood vessels dilated, so BP is less. Also omega-3 fatty acids keep the internal lining of the blood vessels smooth, so it doesn't clotting of the blood vessels. It keeps the vessel smooth, it makes the vessel flexible, it is anti-thrombotic, means it doesn't cause clotting of the blood vessels. It doesn't cause clotting of the blood vessels. That's why it is called anti-thrombotic. While omega-6 fatty acids is pro-thrombotic, means it causes clotting of the blood factors. So therefore, all the inflammatory foods, all the fast foods are contains high in omega-6 fatty acids, and all the real foods, all the fatty fishes contains high in omega-3 fatty acids. So you have to consume a lot of omega-3 fatty acids if you want to make your heart very healthy. So this is one of the primary thing you have to take care. Secondly, omega-3 fatty acids increases the activity of lipoprotein lipase activity. Means what happens is the triglycerides, which is bad cholesterol, it causes decrease in the level of the triglyceride by breaking down the triglyceride. So this fatty acids, how it is important, just imagine that if you have a car and if you put a good fuel in that, your car will run for a longer period. It will not be having any breakdown. Similar thing works with the heart. If you have a healthy oils, your heart will function properly. If you take bad oils, your heart will not your heart will break down at some time. So which are the heart healthy oils? Mostly it is olive oil, coconut oil, groundnut oil, avocado oil, any seed oil, sesame seed oil. All these are healthy oils you need to consume. Secondly is, which are the heart troubling oils, means the heart clotting oils. If you see, sunflower oil is bad oil, hydrogenated oils are very bad. Okay, safflower oil, corn oil, these are heart damaging oils. So try to have heart healthy oils, which is very beneficial for you. Also, you can get eggs, can be beneficial. It contains omega-3 fatty acids. Sometimes most of the organic eggs, it comes in a market in form of omega-3 fatty acid. Also, you can consume that if you are non-vegetarian. So vegetarian sources basically for omega-3 fatty acids is chia seeds, flax seeds, hemp seeds, nuts, walnuts. These are very rich sources of omega-3 fatty acids, especially for vegetarian people. So this is, you need to consume very healthy fat, because it is a lubricant for the vessels and it will keep the vessels smooth and healthy. That is because it contains omega-3 fatty acids. Next is, you have to have a plant-based food. What do you mean by plant-based food? If you have a plant-based food, means most of your diet consists fruits and vegetables, you have a lower risk of heart attacks. Now imagine, it has been study was done in the Lancet, which has been published. If you consume most of the people, they consume plant-based diet for 1 year and without any medications or cholesterol lowering drugs, and they found that the heart conditions and the risk factors for heart disease was reduced. The cholesterol plaques were reduced almost up to 82%. So you can imagine, the based on the plant-based food can be very beneficial for your heart. Second thing is, you should remember that consuming these fruits and vegetables is very important because they contain a lot of fiber. When you have a lot of fiber, it decreases your blood sugar level, it increases your good cholesterol levels, it contains various nutrients, anti-aging factors, which can be very beneficial for your heart. So that's why the fiber in the fruits and vegetables becomes very important. And the fiber in the fruits, you have to consume about 30 grams of fiber per day. That is what is required, 35. That is what is required on a daily basis. Okay. So this fiber, and it has been said, another study was performed by the American Society of the Epidemiology, where they found that most of the premature deaths along millions of people die because they don't consume adequate amount of fruits and vegetables. Now, ideally, it has been said you have to consume around 5 servings of fruits on a daily basis. So 5 servings of fruit means 1 serving of fruits can give rise to 3 to 5 grams of fiber. So if you can have 3 to 4 grams of, if you have 3 to 4 servings of fruits, it will definitely increase your fiber content. Now, I'll let you know which are the fruits very beneficial for your heart. So the first thing is heart. If you see, the red color fruits are very beneficial for the heart. It's not that the red initially, predominantly the red color can be very beneficial. The most heart healthy fruits are the berries, the red berries, strawberries. All these berries are very heart friendly. So you can have Koturi of berries, if you can have it on a regular basis, it decreases your heart attacks and heart risk factors. Secondly is, you should think like, what I want to tell you is the risk factors. Second fruit is avocados. Avocados contain 33% of potassium. When you have so much of potassium, the blood vessels release nitric oxides, and BP is also low. So that's why avocados are very heart-friendly fruits. Second is nuts. If you can consume nuts like walnut, very high in omega-3 fatty acids, decrease your heart attacks. Who likes chocolates? Can you tell me? Can you type in the comment box who likes chocolates? And which is the best chocolates you like? And there is a reason why I'll tell you why you have to go for chocolates at time. Because it has been said that the dark chocolate, not the regular chocolates. Regular chocolates contain sugars, but the dark chocolates contains, if you see, have higher cocoa component. And this cocoa in the dark chocolate, it should be more than 70%. You have to check in the paper that what is the content of the cocoa in that. If it is more than 70%, means it is a very heart friendly. So you have to have dark chocolate, about a piece or two on a daily basis. If you can have, that is very good, but not a regular chocolate, because it contains a lot of sugars. Not this dark chocolate contains less of sugars, but it contains more of chocolate. It contains more of antioxidants. So then other heart-friendly foods are legumes. You can all these legumes, because they contains a lot of heart-friendly components, which can be decreasing the inflammation of the heart. Tomatoes are supposed to be a very heart-friendly food. So if you consume tomato, contains lycopene, which is anti-inflammatory and very beneficial for the heart. So try consuming tomatoes on a regular basis. And apple. It is said that an apple a day keeps a cardiologist away. So try consuming an apple, which is with the peel. Don't remove the peel, because it contains a lot of fiber. So these are the fruits and vegetables, fruits you can consume on a daily basis, which can be very beneficial for the heart. In addition to that, cruciferous vegetables like cabbage, cauliflower, this is also add to the fiber in the diet. So that also you can consume. Beverages, which are the favorite beverages you can go ahead? The favorite beverages you can have is green tea on a regular basis. If you can consume 2 or 3 cups of green tea on a regular basis, definitely you'll decrease your risk of heart disease. You can check my video on YouTube where I mentioned about what are the benefits of the green tea. So green tea is very beneficial. Then spices, which are the spices you have to have in on regular diet? The spices is, first thing is garlic. If you have a clove of garlic on a regular basis, just a small piece, it can reduce your cholesterol level to 7 to 9% regular basis. It is also anti-thrombotic, means it prevents clotting of the blood factors. So that's why it helps in the heart health. Second is turmeric. The curcumin in turmeric has a anti-inflammatory effect. That's why it is very beneficial for the heart. Then other spices, like you can have black pepper. It's called the king of the spices, because it contains zinc, potassium, magnesium, which helps preventing clotting of the blood factors. That is very beneficial. So these are the spices you need to add to your diet. Even ginger contains gingerol, so which is heart protective. So if you add the spices, anyway, Indian diet contains the spices, but on a regular basis, if you want to have clove on a daily basis also, you can have, because it will help in reduction of your cholesterol level. So these are the few foods you need to consume on a regular basis. Even nuts, if you can consume one what is a cantori of nuts, if you can consume, it contains around 4 grams of fiber. So having nuts on the regular basis, whole grains like quinoa, brown rice, red rice, millets, these are all add to your fiber in the diet. So fruits and vegetables increase your fiber content, that is helps you in your heart health. Fruits, which I mentioned, these are different types of fruit. You need to consume at least 5 servings per day to have a protective effect on the heart. The spices, which I've told you, which will be very beneficial, and the beverages like green tea, which can be very protective to the heart. Okay, are you there with me now? Okay, just comment me on the box that you are there with me. Hi, send me a hi to me now. so that I can know that you are there with me still now. So any doubts, if you have any questions, just comment on the comment box so I can answer you at the end. Okay. Then we have considered about the foods. Now we'll come to the most important part, is stress management. You must have seen that most of the people, when they get a severe stress, they immediately collapse, because the brain and the heart has a direct connection. So you must have seen a lot of people, when they invest in stocks, the stock market, if it crashes, they immediately succumb to heart attacks. So this is what happens to them. So stress management is very vital, because if the stress is very high, the cortisol is released from the brain. And the cortisol, what happens is, when it's released from the brain, it constricts the blood vessel, means it narrows the blood vessels around the heart, and it decreases the blood supply to the heart. So immediately you will feel the heart attacks because of the severe stress. So how you will relieve your stress on a daily basis? The best thing is available in the market, and it is freely available, you need not buy from anyone, is yoga and meditation. Try doing yoga on a regular basis. Meditation, if you can do meditation for 10 to 15 minutes on a daily basis, or breathing meditation, just close your eyes and just focus on your breath, up, ingoing breath, outgoing breath. Just focus on your breath. If you can focus for 10-15 minutes, it is very vital, very crucial in reduction of your stress. Other thing helps in stress management is you need to have an adequate sleep. Adequate sleep of 7 to 8 hours is very, very crucial. If you don't have an adequate sleep, your brain will be a drowsy state. So then what happens is, it directly affects your heart functioning. Also, what happens is, when you sleep adequately, it releases a hormone called growth hormone, which helps in the repair of tissues at the night time. So basically, when you have a proper sleep, the growth hormone is increased, and the growth hormone helps in repairing of the cell. And when you don't have a proper sleep, you tend to consume more calories, put on more weight, and that adds to your risk factors. So this is how you manage your stress. Also, a good exercise can also help you in managing your stress. So okay, all these people have said hi to me. Hi Manda, hi Pallavi, hi Dia. Thanks Gaurish for the comment. Abhilashi, namaste. Thanks for your comments. So now I've told you about the stress management. Now I'll tell you about the exercise. The exercise is very, very crucial for the heart. And now exercise means you have to do exercise in such a way that you have to increase your heart rate for at least for 20-30 minutes. You can do any sort of exercise, whether it is swimming, whether it is jogging, cycling, whatever exercise you do, you can do. But see that your heart rate is increased at maximum rate. The heart rate should go at a very high rate, at least for 20-30 minutes. If your heart rate is very, very high, it will have a protective effect on your heart. Now, those who do regular exercise, they have a big coronary arteries. The coronary arteries are the arteries which supply blood flow to the heart. So when you do regular exercise, the size of the arteries are more. It has been shown by studies. So doing regular cardio workout, which at least for 30 minutes, it is what is required. You have to increase your heart. So increase the capacity of the heart increases, and that will keep your heart very, very healthy. That is what is required in terms of exercise. Also, exercise helps in the crucial thing I've just told you. We have an internal form. Whenever you exercise, our body releases omega-3 fatty acids, and also nitric oxide is released from the blood vessel. So it is a vasodilator. So exercise, if you do, the internal lining of the blood vessels is smooth. It doesn't cause clotting of the blood vessels. So it helps keeping your blood vessels smooth internally. It also decreases your bad cholesterol and triglycerides. Also, it helps, it keeps the level down. It helps in opening of your blocked vessels also. If you do regular exercise, you can definitely sure that it can open your blocked vessels also. And exercise also stimulate growth of new blood vessels, that is by means of endothelial growth factor. So try doing exercise for minimum 30 minutes on a regular basis. See that your heart rate is increased, that will increase your capacity. So this is very crucial and very important in this factor. How many of you all exercise on a regular basis? Can you type in the comment box? How many of you all exercise? Hi Tulika. Hi Trusha. How many of you all exercise on a regular basis? It can be anybody, anything, yoga, meditation, or anything. I just want to know how active you are. Okay, next thing is I want to say, like, now we require some supplements which can help you in protecting your heart. There are two supplements which you can take for protecting your heart. One is vitamin D and one is vitamin K. It has been shown by studies that if you have low levels of vitamin D, Trisha saying is I exercise at least for 45 minutes. That's good, very nice. 45 minutes is good. See that you do a regular basis. It will keep your heart very healthy. Then I'll just spoke to you about in this regard that which are the vitamins required. Vitamin D is very, very crucial because it has been shown by studies if vitamin D levels are very low, you're prone for heart attack. So see that your vitamin D levels are between 40 to 70 in that range. Don't consume excessive amount of vitamin D. Try a 3-month course of vitamin D if your vitamin D levels are below 30, and then you can take for 3 months and then stop it, then check later on what is the vitamin D levels. So that will help you in maintaining an adequate level of vitamin D. Second thing is you have to take vitamin K. Vitamin K, what happens is as you grow, as you age, the chances of vessel becoming stiff, the chances vessel becoming narrow, and also the calcification of vessel, more calcium deposit occurs in the heart vessels. So you have to avoid this. So what you can, calcium, vitamin K prevents the deposition of calcium on the blood vessels. So vitamin K on a regular basis you can have. By means of food, it may be difficult to have so much quantity. 250 to 1000 micrograms of you require vitamin K on a regular basis. So these two vitamins are very vital for your health. Okay. Then one more thing is what Ayurveda says. Ayurveda says there is one tea which is very good. It's called the Arjuna tea, and it has been mentioned for in the ancient Ayurveda text. Even Bhagavata says that, and ancient Ayurveda says that Arjuna bark tree, which has been said years before, that is very, very good for your heart. Now Arjuna bark, it can come as a tea form, it can come as a what do you call as a powder form, it can come as a tablet form also. Now according to Ayurvedas, this Arjuna tablets or tea, bark tree, it has been said it is cardiotonic, means it is like a tonic to the heart. It increases the muscle capacity, muscles functioning is very, very increased. Then heart rate is lower. Then it decreases the lipid levels, cholesterol levels are low. So if you can consume on a regular basis the Arjuna tea or Arjuna tablets, but see that you consult an Ayurvedic doctor before that, before starting it, and that is also very important. So this is according to Ayurveda, it is mentioned that Arjuna tea or tablets are very, very good for your heart. And then one juice I will recommend for you, if you can have, it can be very beneficial for your heart, is Lauki. This is bottle gourd juice. If you can consume bottle gourd juice once in a week, because this, if you see the bottle gourd Lauki, which is say, it contains lots of water. It contains so much, 90% of water. It contains vitamin K, vitamin C, calcium, magnesium, which is very, very crucial for your heart health. So if you can consume Lauki once in a week, that will be very beneficial for your heart. So this is how you should maintain your heart health, because heart health is very, very important, because we have only one heart, and if the heart is damaged, it's very difficult to replace. But definitely if you can maintain your lifestyle, if you can maintain your proper habits, proper diet, definitely your heart can be reversed back. Try maintaining a proper lifestyles. See our ancestors, they were very healthy. They used to be very healthy in terms of heart overall, because they used to be regular active. And I just want to add one more thing, since because in the corona we are most of the time indoors, also we think like how we can maintain a healthy thing. You can just see that you walk at least for 10,000 or 15,000 steps you should maintain. You can see on a mobile, if you have iPhone, you can just check out how many steps you walk on a daily basis. So you should have at least minimum 10,000 to 15,000 steps per day to keep a heart healthy. So check on your mobile how many steps you walk on a daily basis. The recommended is 10,000 to 15,000. If you're continuously in the front of a camera, in the front of your laptop working, you can do a chair yoga. You can just relax your muscle, get in between up, and just walk around. That is also helpful. So the more the active you become on your daily basis, the more beneficial for your heart. So try. So whenever it comes to the heart, see that you change your lifestyle, it will definitely benefit. But if you're on medications for a heart disease, don't stop the medication immediately. You continue on your medications and introduce all these changes little by little, and then over the period of time, if you are confident enough, then you can say that I require a lower dose of all these tablets. But don't stop your tablets immediately, because you have to take a consult of a doctor, because this heart disease has not occurred within 1 or 2 days. It took years for you to develop this heart disease. Similarly, if you stop immediately all this medication, the heart will not able to cope up, and immediately it will give away and it will stop functioning. So see that you don't stop your tablets immediately. Introduce these lifestyle changes, and over the period of time, you'll see that your heart capacity is definitely more than before. So consult your doctor for whatever tablets. And this the diet thing is you can do on a regular basis. More of fruits, vegetables, more of fiber, more of nuts, more of beverages like green tea, then spices, regular stress management, regular exercise, and Arjuna tea, which I've mentioned in case of Ayurveda. They mentioned you can just check out Arjuna. It comes in a tea, tablets, you can consume that. And Loki juice, you can have weekly basis. Definitely it will help you in your maintaining your proper health, heart health. Okay, so today is a World Heart Day, so I wish you a very healthy heart day. Also see that if you like this video, kindly share this video with a friend, because sharing is caring. So if you like your loved ones also, you need to take care of your heart health of your own and also of your family members. So if you think this is very valuable information, kindly share this video on your Facebook page, or share to your friends, so that they can benefit in case of a heart disease they're having. I have my own Facebook page, Dr.SwapnilsHealthARC. You can subscribe to that. I have regular posts there, health and wellness tips in that. I have a Facebook, I have a YouTube page also, Dr. Swapnil's Health Arc. You can check out for regular videos on that. So subscribe to my channel, okay? And if you find valuable information, please share with your friends. And thanks for being live on this session. I appreciate your valuable time, and see you next time for the live session. Thank you. Good night.